Rear Admiral Elias Voss refused the first surgeon before the trauma doors had fully opened. He arrived beneath a silver thermal blanket, his dress shirt cut from collar to waist, blood darkening the gauze pressed against his left side. Rainwater shone in his gray hair. His pulse raced at 143, yet his eyes remained clear. "Admiral, lie still," Dr. Adrian Kessler said, walking beside the stretcher. Voss gripped the rail. "No surgery. You may be bleeding internally. No sedation." Kessler looked toward the paramedics. "He was conscious at the crash site," one said. "Refused pain medication. Kept asking whether the other crew had been found. There was only one helicopter," Kessler replied. "Only one that reached us." Voss heard that. His monitor jumped. Kessler leaned closer. "You survived a hard landing. Your abdomen is rigid. Your pressure is dropping. If a vessel ruptured, every minute matters." Voss turned toward the open trauma bay. Doctors, residents, nurses, security. Then he saw the woman carrying a sealed instrument tray through the far doorway. She wore navy blue scrubs that were still too new to have softened at the seams. Her badge read, Mara Keene, RN. Her black hair was pulled into a low knot. She had worked at Atlantic Naval Medical Center for 23 days. Voss lifted one shaking hand and pointed directly at her. "No surgeons," he said through clenched teeth. "Only Operator Raven." The stretcher stopped. Mara took one more step before the name reached the part of her that had spent 7 years pretending not to exist. Raven. A name shouted through rotor noise. A name written across a flight helmet. A name Gabriel Shaw had used the night the sea caught fire. Before we continue, welcome to Emergency Legends Archive. If stories about quiet heroes and impossible rescues are your kind of story, subscribe, leave a like, and tell us where you are listening from. Kessler recovered first. "Admiral Voss is confused from blood loss," he said. "Keene, set that down and leave the bay." Mara placed the tray on the counter. Voss struck the rail with his palm. "Raven stays." Kessler glanced at Mara. "Do you know him?" She studied the Admiral's face. Older now, thinner. A pale scar disappeared beneath the collar of his torn shirt. The eyes were the same. Steel blue. Calm under pressure. Dangerous when ignored. "No," she said. Voss watched her lie. Kessler turned to the team. "Fast exam. 2 large-bore IVs. Type and cross 6 units. Call vascular. Prepare or2. Mara should have moved with it. Instead, she noticed Voss's left hand. 2 fingers touched his thumb. Pause. 2 fingers again. Compromised root. Her hand answered before thought could stop it. Palm down. 1 short motion. Alternate path. Voss closed his eyes for half a second. Kessler caught only the end of the gesture. "What was that?" "Nothing." "Then leave." A resident cut away the remaining fabric over Voss's abdomen. Old scars appeared beneath fresh bruising. One vertical line crossed the center. Another curved toward the left hip. Between them sat a jagged mark that looked less like surgery than survival. Mara knew that scar. She had held pressure beside it, while Gabriel built a temporary shunt beneath red light and incoming fire. Kessler pressed the ultrasound probe against Voss's abdomen. Dark fluid appeared near the spleen. "Free fluid," he said. "We are done waiting." Dr. Lena Ortiz entered in dark green scrubs. "What do we have?" "Helicopter impact, hypotension, positive fast, likely splenic or vascular injury." Ortiz studied the screen. "CT?" "Too unstable." Mara moved closer to the foot of the bed. "Check his left femoral pulse." Kessler did not look at her. "Keene. It is not where it should be." That made Ortiz turn. Kessler straightened. "You were told to leave." His pulse is displaced medially. "Based on what?" "The contour near the old incision. You are diagnosing vascular anatomy from scar tissue? I am telling you the vessel may have been rerouted." Ortiz palpated Voss's left side. Her expression changed. "Kessler." He checked for himself. The expected pulse was weak. 2 inches inward, it struck hard beneath his fingers. Kessler looked at Mara. Suspicious now. "How did you know?" Mara did not answer. Voss's lips moved. "Same map." Mara leaned closer. Kessler caught the phrase. What does that mean? Voss kept his eyes on her. She asked, Same map? One blink. Yes. The trauma bay vanished for one violent instant. Black water below. A helicopter balanced on one skid. Gabriel kneeling over Voss with blood to his elbows. The original artery shredded by metal. No vascular surgeon. No operating room. 12 minutes before hostile vehicles reached the ridge, Gabriel had pointed to the improvised bypass and shouted over the engines. Same map if he ever goes down again. Mara had promised she would remember. The monitor alarmed. Blood pressure? 76/42. Voss's hand slipped from the rail. Kessler moved fast. We are going now. Exploratory laparotomy. Midline approach. Mara's body went cold. No. Kessler looked at her. Excuse me? Do not open him through the old midline. We do not have time for this. The bypass crosses beneath it. You cannot know that. I do. How? Mara looked at Voss. He had trusted her once in a place where trust lasted seconds. Now he was doing it again. Kessler stepped closer. Nurse Keene, you are 23 days into probation. You have no surgical authority, no access to this man's classified history, and no place obstructing my team. I am not obstructing you. You are contradicting the attending surgeon, because you are about to cut into an artery. Ortiz looked at the scars. Adrian, if there is an undocumented graft, there is no graft in his chart. Then the chart may be incomplete. Kessler's jaw tightened. We have a crashing patient. We use the information we have, Mara said. Then get better information. Ortiz moved the probe lower. The image showed turbulence, then vanished beneath bowel gas. Not enough, she said. Could be native vessel. Could be graft. Voss tried to speak. Only air came out. His fingers moved against the sheet. Night bridge. Mara answered quietly. I remember. Kessler heard her. Remember what? Mara straightened. 7 years ago, his left iliac artery was destroyed in the field. A temporary bypass was built across the lower abdomen and revised later under a sealed military program. The vessel does not follow standard anatomy. Ortiz's eyes sharpened. Were you there? Kessler cut in. Do not encourage this. The midline is not safe, Mara said. If the reconstruction was preserved, you need lateral access or imaging before incision. Voss's pressure fell again. 68/38. Kessler made his choice. Move him. The team unlocked the stretcher. Mara stepped aside as it rolled toward the surgical corridor. She could have let them pass. She could have returned to the supply room and remained what everyone believed she was. A rookie nurse. Quiet. Unimportant. Safe. Then Voss's eyes found hers as the stretcher passed. Not pleading. Ordering her to remember who she had been. The elevator doors opened. The monitor released a long warning tone. Voss arched once beneath the blanket. His pressure vanished from the screen. No palpable pulse, the resident said. Keep moving, Kessler ordered. We open immediately. Mara grabbed the side rail and stopped the stretcher. 3 people shouted at once. She saw only the scar, the hidden route. Gabriel's blood-covered hands. Mara looked directly at Ortiz. Do not cut through the midline, she said. His artery is not where your scan says it is. His artery is not where your scan says it is. Mara's voice cut through the alarm. Dr. Kessler stared at her hand gripping the stretcher rail. Let go. Voss lay motionless beneath the trauma blanket. The monitor could not read his pressure. His skin had turned the color of old paper. Dr. Ortiz pressed 2 fingers against his neck. Carotid pulse, weak. Then move, Kessler said. We are losing him. Mara did not release the rail. If you open through the center, you may cut the bypass before you see it. You do not know there is a bypass. I watched it being built. The hallway went still. Not silent. The monitor still screamed. Wheels still rattled. Someone tore open a bloodline package. But every face turned toward Mara. Kessler's expression changed first. Not belief. Calculation. You said you did not know him. I said what kept the room moving. You lied. He is bleeding. Ortiz stepped between them. Mara, tell me exactly what was done. Mara looked at Voss. 7 years disappeared. A dark ridge above the sea. Rotor washed throwing sand against her goggles. Gabriel Shaw on his knees beside Voss, one gloved hand buried in blood, the other holding a piece of tubing that had never been designed to become an artery. "No hospital," Gabriel had shouted. "No vascular kit. We bridge now, or he dies here." Mara returned to the corridor. His left iliac artery was destroyed below the bifurcation. A temporary extra anatomic shunt was routed medially across the lower abdomen. Ortiz frowned. Temporary shunts do not stay 7 years. It was revised after evacuation. How? I was not in the operating room. But you saw the final imaging? Yes. Kessler laughed once. This is absurd. Mara ignored him. The graft crosses behind the old midline scar, then curves toward the left femoral vessels. If the crash tore the connection or formed a pseudoaneurysm, a standard incision could enter it. Ortiz looked at the weak pulse beneath her fingers. What material? I do not know. Diameter? 8 millimeters in the field. The revision may be larger. Any renal involvement? No. Any infection history? Not then. Kessler stepped closer. You are giving surgical advice based on a memory from 7 years ago. Mara met his eyes. I am giving you the only map you have. Voss's heart rate climbed to 160, then dropped to 120. Ortiz turned. Massive transfusion protocol. 2 units now. Pressure bag. Calcium ready. Kessler pointed toward the operating room doors. We do not have time for imaging. We do not have time for a blind incision either, Ortiz replied. He has free fluid and shock, and abnormal anatomy. Kessler lowered his voice. You are allowing a probationary nurse to direct the case. No, Ortiz said. I am allowing new information to change the plan. The first unit of blood ran. Voss's eyelids moved. Mara leaned near him. Admiral. His eyes opened, barely. Stay with me. His fingers shifted against the sheet. One short motion. Cold route. Mara understood. You remember the water? One blink. His eyes stayed fixed on hers. Ortiz noticed. What is he saying? That he remembers me. Kessler folded his arms. Convenient. Mara turned toward him. His confusion disappears every time he looks at me. Does that seem convenient? Voss moved his hand again. 3 fingers. Closed fist. Thumb across. Watch the exits. Mara looked toward the stairwell, elevator, and operating room doors without meaning to. Voss saw it. His mouth almost formed a smile. Ortiz saw that too. He did not recognize your face first, she said. Mara shook her head. He recognized the way I entered the room. What way? Counting doors. Checking corners. Keeping my back off the glass. Kessler's expression hardened. What were you? Mara did not answer. The pressure finally appeared. 62/34. Not enough. Ortiz made the decision. Hybrid suite. Kessler stared at her. Lena. We stabilize him under fluoroscopy. Angiography first. If the graft is intact, we open. If it is ruptured, we gain proximal control before touching the abdomen. The hybrid room is 15 minutes away from ready. Then make it 5. The surgical coordinator ran ahead. Kessler moved beside the stretcher. If he dies waiting, if he dies because you cut an undocumented graft, waiting will not be the problem. They rolled. Mara walked at Voss's head, one hand near his shoulder without touching him. He watched her every step. The corridor lights passed above them. White. 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 Then one flickered. For a second it became red. Mara smelled fuel. Not antiseptic. Fuel. Salt water. Burned fabric. Gabriel's voice came through the years. Raven, the shunt is holding. Get him off this ridge. She had looked toward the lower path. Gabriel had been bleeding beneath his vest. You come too. No room on the first lift. Then we wait. No. He had grabbed her wrist. You fly, Voss. I cover the second extraction. Mara blinked. The hospital returned. Voss was still watching her. His lips moved. Gabriel. Her hand tightened around the rail. Do not. His eyes softened. Not now. That was what he meant. Ortiz glanced over. Who is Gabriel? No one involved in this surgery. Kessler heard the answer. Everything about you seems classified when it becomes inconvenient. Mara looked at him. Everything about him became inconvenient when it stopped fitting your plan. The hybrid suite doors opened. The team transferred Voss beneath the imaging arm. Ortiz scrubbed. Kessler remained on the opposite side of the table, still attending, still unwilling to surrender the case. Mara stayed near the head. An anesthesiologist named Dr. Malik Chen placed an arterial line while Voss was awake. Admiral, I need to sedate you. Voss shook his head. Not yet. You are in profound shock. Voss pointed toward Mara. Raven. Chen looked at her. What does he want? To know I will stay until he is asleep. Kessler said, You are not part of the operative team. Ortiz did not look up. She stays for consent and orientation. Kessler's jaw tightened. Mara leaned close. They need to place a breathing tube. Voss's eyes moved toward the ceiling. You will wake up. A pause. Do you understand? One blink. Do you consent? One blink. His fingers caught the edge of her sleeve. Same map, he whispered. Mara lowered her voice. I remember every turn. His grip loosened. Chen pushed the medication. Voss's eyes closed. For the first time since he arrived, the Admiral stopped fighting. The room moved faster after that. A catheter entered through the right femoral artery. Contrast filled the screen. Ortiz watched the vessels appear in pale, branching lines. Native anatomy first, then the left side. The image shifted. A long, curved graft crossed the lower abdomen exactly where Mara said it would. Nobody spoke. The contrast reached the midpoint, then burst outward into a dark swelling. Ortiz leaned closer. There, the pseudoaneurysm sat beside the old graft like a second heart. Unstable, leaking, one layer away from rupture. Kessler's face changed. Mara saw the moment certainty left him. Ortiz traced the image with one gloved finger. The crash disrupted the proximal connection. Kessler said nothing. If we open through the midline, Ortiz continued, we would have entered the graft before controlling inflow. Chen looked at the pressure. 58 systolic. Ortiz spoke quickly. Balloon occlusion proximal to the graft. Prepare covered stent. Surgical backup ready. Mara stepped away from the table. Her work here was finished. Kessler looked at her across the equipment. You could have mentioned this before tonight. I did not know he would arrive in your emergency room. You hid a medical history. It was not mine to disclose. A graft is not a military secret. The operation around it was. And now a patient nearly died because civilians were not told. Mara looked at Voss's still face. That part is true. Kessler seemed surprised by the agreement. She continued, But he nearly died tonight because you believed a blank chart more than the patient in front of you. Ortiz cut across them. Enough. The balloon inflated. The leaking slowed. Voss's pressure rose to 74, then 81. Chen exhaled. We have response. Ortiz deployed the stent across the damaged connection. Contrast flowed again. This time, it stayed inside the vessel. No extravasation, she said. The room released a breath it had been holding. Not victory. Not yet. But control. Ortiz looked toward Mara. You were right. Kessler turned away. Mara shook her head. I remembered correctly. That distinction just saved him. The words landed harder than praise should have. Mara looked at the old graft on the monitor. 7 years ago, Gabriel had called it temporary. A bridge made in darkness. A desperate line carrying blood through a body that should have died. It was still there. So was she. A nurse entered the suite. More casualties arriving from the crash. Ortiz did not move her hands. How many? 8 confirmed. Maybe 9. 1 ambulance is still inbound. Mara looked toward Voss. His blood pressure had stabilized enough for the team to continue. Kessler answered without turning. Send them through standard trauma triage. The nurse nodded. Mara said, Do not discharge anyone based on the first scan. Kessler faced her. You are not directing those cases too. They were in the same aircraft. That does not give them the same injury. No, it gives them the same mechanism. Ortiz glanced at the angiography screen. Mara may be right. Kessler laughed without humor. Of course she may. The suite doors opened again. This time, a paramedic rolled in a sealed evidence pouch containing Voss's torn uniform, watch, and identification. A small black object rested beneath the watch. A damaged flight recorder key. Mara recognized the unit mark scratched into its casing. Voss had not been a passenger. He had been carrying something. Chen reduced the sedation as the procedure ended. Voss's eyes opened slowly. Mara returned to the table. Your graft is repaired. His gaze found her. Others? They are arriving. His hand moved weakly. 9. Mara thought she misunderstood. 9 survivors? One blink. She leaned closer. Admiral, the manifest lists 8 with you. His lips parted. Not manifest. The monitor climbed. Mara put a hand lightly against the sheet beside his arm. Who is missing? Voss fought for air around the tube. Chen warned, do not make him talk. Voss's fingers closed around Mara's wrist. His voice came out broken. 9 more. Mara froze. Voss pulled her closer with what little strength he had. Do not let them send anyone home. From beyond the hybrid suite doors came the sound of wheels. One stretcher. Then another. Then many. The emergency entrance alarm sounded across the hospital as the first convoy of ambulances arrived. The ambulances arrived in a line of red light, one after another. 8 stretchers crossed the emergency entrance in less than 6 minutes. The first carried a young flight mechanic with a blood-soaked bandage around his forehead. The second carried a Navy lieutenant whose left arm had been splinted against his chest. The third carried a woman in a flight suit, conscious and furious, insisting she could walk. Behind them came 5 more survivors. Different injuries, different expressions, the same rainwater on their uniforms. Mara stood outside the hybrid suite, while the hospital divided them into rooms. Voices filled the corridor. Trauma 3 is open. Send radiology to 5. Get orthopedics down here. Where's the passenger manifest? Admiral Voss is still in procedure. Dr. Kessler stepped out of the hybrid suite, removing his gloves. The damaged graft had been temporarily sealed. The immediate bleeding had stopped. But Voss still needed definitive repair and several hours of surgery. Kessler looked toward the incoming patients. Standard trauma protocol, he said. Anyone stable after imaging goes to observation or discharge. Mara turned toward him. He warned us not to send anyone home. He was in shock. He knew the number of survivors. He also called a probationary nurse by an operator name. Mara held his stare. And he was right about that too. Kessler's face tightened. Before he could respond, Dr. Lena Ortiz pushed through the doors. We are taking Voss to OR4, she said. The stent bought us time, but the graft wall is damaged. I need full surgical exposure and blood available. She looked at Mara. Walk with us. Kessler objected immediately. She is not part of the operating team. She remembers the reconstruction. We have angiography now. We have an image, Ortiz said. She has context. Mara walked beside the stretcher as Voss was moved toward surgery. He remained sedated. His face looked older without anger holding it together. Ortiz pointed toward the image on a portable screen. The graft curves behind the scar, then splits here. Mara nodded. The original field shunt entered lower. You are certain? Gabriel moved it during evacuation because the first connection was kinking. Ortiz glanced at her. Gabriel Shaw. Mara's steps slowed. You know the name. Voss said it before sedation. He was the medic who built the first bridge. With you? Yes. Where is he now? Mara looked ahead. Not here. Ortiz understood enough to stop asking. At the operating room doors, Mara gave the last detail she remembered. The distal connection was protected with a metal marker. Small, triangle-shaped. Ortiz studied her. You remember that after 7 years? I remember everything from that night. The doors opened. Kessler stood inside. That is enough. Ortiz looked back at Mara. If we find the marker, I will know the rest of your map is accurate. Mara did not tell her the map had never been the problem. The problem was what waited at the end of it. The doors closed. Mara returned to the emergency department. The crash survivors had been spread across 3 trauma rooms and 5 examination bays. The noise was controlled now. That worried her. Disasters often became dangerous after the screaming stopped. She started with the patients classified as stable. Lieutenant Sadie Monroe sat in Bay 6 with a brace around her wrist. Her blood pressure was normal. Her first abdominal scan was clear. She complained only of soreness across her lower ribs. Mara checked the bruising left by the restraint harness. A dark line crossed from right shoulder to left hip. Where were you sitting? Rear cabin, starboard side. Did you lose consciousness? No. Nausea? A little. Abdominal pain? Just from the belt. Mara pressed gently beneath the bruise. Sadie flinched. Not much. Enough. Do not eat or drink yet. Sadie looked toward the discharge paperwork at the foot of the bed. They said I can leave after one more set of vitals. Not yet. In Bay 7, Petty Officer Marcus Hale had a broken collarbone and nothing else documented. His pulse was 112. His skin felt cool. He said he was fine. People in uniform often said that when they were not. Mara asked where he had been sitting. Across from Monroe. Same area, same restraint angle, same mild abdominal tenderness. In Bay 8, a rescue swimmer named Daniel Brooks sat upright on the bed while a resident removed glass from his hair. 26 years old. No fracture. No head bleed. Normal first scan. His only complaint was thirst. Mara looked at the monitor. Pulse 118. Blood pressure 106/68. Not alarming. Not good. How long were you trapped after impact? Maybe 12 minutes. Did the seat move? It tore loose on one side. Which side? Left. He smiled. Is this an interrogation? Yes. The smile faded. Mara pressed lightly near his navel. Daniel inhaled sharply. That hurt. Only when you push. That still counts. The resident looked over. His CT was negative. How long ago? 40 minutes. Repeat his lactate and hemoglobin. The resident frowned. He is young, stable, and already cleared by trauma. Mara looked at Daniel's hands. They trembled slightly. He is compensating. For pain. For blood loss. The resident's expression hardened. Based on what? Pulse, skin temperature, seat position, restraint pattern, and worsening tenderness. That is not enough for another scan. It is enough for repeat labs. Kessler appeared at the doorway. What is happening? The resident answered quickly. Nurse Keene wants repeat testing on 3 cleared patients. Kessler looked at Mara. You left Voss's case and came here to diagnose the entire helicopter. I came here because he warned us. He was injured and disoriented. He counted 9 survivors no one had documented. We are still confirming the manifest. Mara handed him Daniel's chart. His pulse has climbed 16 points in 30 minutes. He is anxious. His pressure is narrowing. It is still normal. Until it is not. Kessler closed the chart. These patients have been examined, scanned, and triaged. You are not ordering duplicate testing because one extraordinary case made you feel infallible. Mara's voice stayed level. I do not feel infallible. You certainly sound convinced. I sound concerned. You sound like someone who has forgotten her role. Daniel shifted on the bed. His hand moved toward his abdomen. Mara noticed before anyone else. Daniel, I am fine. His face had lost color. The monitor changed. Pulse 132. Blood pressure 94/58. Mara stepped closer. Lie down. I said I am... His sentence ended. Daniel folded forward and slid from the bed. Mara caught his shoulder before his head struck the floor. The monitor alarmed. Get the stretcher flat, she said. The resident froze. Mara looked up. Now. They moved. Daniel's eyes fluttered. His abdomen had become firm, not hard everywhere, hardest near the center. Kessler reached for his wrist. Pressure? 78/40, the nurse at the monitor said. Mara pulled the blanket back. A faint purple stain was spreading beneath the skin across his lower abdomen. Late bruising, hidden damage, internal bleed, she said. Possible mesenteric tear. Kessler snapped into motion. Activate trauma. Repeat fast. Call surgery. The resident reached for the ultrasound. Mara placed oxygen over Daniel's face. Daniel, open your eyes. No response. The ultrasound screen filled with dark fluid. The resident's voice changed. Free fluid. Kessler looked at Mara, only for a second. Then away. Massive transfusion protocol. Or now. Daniel's hand lifted weakly and caught the edge of Mara's sleeve. Admiral? He is alive. The others? We are checking them. His grip tightened. Do not let them leave. The same words. Mara looked toward the other bays. Sadie Monroe sat behind a curtain with discharge papers waiting. Marcus Hale had already changed back into half of his uniform. Mara turned to the charge nurse. Stop every discharge from the crash. Repeat vitals, hemoglobin and lactate. Serial abdominal exams on all of them. Kessler said, I give the orders. Then give that one. His eyes flashed. This is my emergency department. And those are your patients. For one hard second, neither moved. Then Kessler looked at the blood on the ultrasound screen. Hold all discharges, he said. Repeat labs on the remaining crash survivors. The charge nurse hurried away. Daniel was rushed toward surgery. Mara walked beside him until the elevator. His pressure remained dangerously low. A trauma surgeon met them at the doors. What happened? Kessler answered. Delayed mesenteric hemorrhage after blunt deceleration. The surgeon looked at the original report. First scan was normal. Mara said. The injury evolved. Kessler's jaw shifted. He did not correct her. The elevator doors closed around Daniel. Mara watched the numbers disappear above the frame. 1, 2, 3. She had saved the Admiral from the wrong incision. Now Daniel had collapsed minutes before leaving the hospital. 2 patients. 2 warnings dismissed. Behind her, the remaining survivors were being pulled back into beds. Sadie's repeat pressure had dropped. Marcus's hemoglobin had fallen. Not enough to operate. Enough to prove the night was not finished. Mara returned to the central desk. Kessler waited beside her badge station. He held a form in one hand. You accessed restricted imaging, interrupted surgical transport, and issued clinical directives without authorization. Mara looked at the form. Daniel would be in a parking lot right now. He is alive because the department responded. He is alive because he collapsed before you discharged him. The nurses nearby stopped speaking. Kessler lowered his voice. You are using a crisis to challenge authority. No. Mara removed her badge from her scrub top. I am using authority to challenge a crisis. His expression hardened. You are suspended pending investigation. The words moved through the emergency department. Mara placed her badge in his hand. Behind Kessler, Sadie Monroe began vomiting. A nurse called for help. Marcus Hale's monitor alarmed in the next bay. The crash was still unfolding inside their bodies. Kessler closed his fingers around Mara's badge. You will leave the clinical floor now. The emergency entrance doors opened. A tall man in a dark navy uniform stepped inside, carrying a sealed black folder. 2 military police officers followed him. He surveyed the crowded trauma ward, the stopped discharges, the wounded survivors. The rookie nurse standing without a badge. Then he looked directly at Kessler. His voice was quiet. That made every person hear it. Which one of you suspended Operator Raven? Which one of you suspended Operator Raven? The question crossed the emergency department like a command. No one answered. The man in the dark navy uniform stood just inside the entrance, rain still shining across his shoulders. Silver oak leaves marked him as a captain. His face was lean, controlled, and tired in the way of someone who had spent the night receiving reports that kept getting worse. The sealed folder beneath his arm carried no hospital logo, only a red classification stripe. Dr. Kessler stepped forward with Mara's badge still closed inside his hand. I am Dr. Adrian Kessler, Chief of Trauma. Nurse Keene was removed after repeatedly acting outside her assigned authority. The captain looked at the badge, then at Mara. Nurse Keene? Mara recognized him before he gave his name. Not personally. By posture, feet balanced, hands visible, eyes moving from exits to patients before settling on the person speaking. Operational. Captain Jonah Reed, he said. Naval Special Warfare Medical Liaison. Kessler straightened. Captain, this is an active civilian medical environment. Whatever history she has with Admiral Voss does not excuse insubordination. Reed's expression did not change. Where is the Admiral? Operating room. Why? Ruptured pseudoaneurysm involving an undocumented vascular graft. Reed's eyes moved toward Mara. She found it? Dr. Lena Ortiz entered from the surgical corridor before Kessler could answer. Blood marked one sleeve of her green scrubs. She prevented us from opening through it. Reed nodded once. And the other survivors? Daniel Brooks is in emergency surgery, Mara said. The remaining patients are being re-evaluated for delayed abdominal injuries. Kessler looked toward her. You are suspended. Reed finally turned fully toward him. On whose clinical recommendation? Mine. After she identified 2 life-threatening injuries? After she issued orders, accessed restricted information, and obstructed transport. Ortiz crossed her arms. She obstructed a fatal incision. That does not change hospital policy. No, Reed said. It changes the consequences of applying it badly. Kessler's jaw tightened. This hospital does not take command from military liaisons. I am not commanding your hospital. Reed placed the sealed folder on the desk. I am correcting information your hospital did not have. Mara stared at the red stripe. She knew what lived inside folders like that. Not the full truth. Never the full truth. Enough truth to make ordinary rooms uncomfortable. Reed opened the cover. The first page contained Mara's photograph. She was 26 in it. Hair shorter, face harder. Flight suit zipped to the throat. A black raven patch sewn beneath the name strip. The charge nurse leaned closer. Kessler did not. He already understood what the image meant. Reed read from the page. Staff Sergeant Mara Keene, Joint Medical Recovery Detachment, Flight Qualified Trauma Specialist, Advanced Austere Medicine, Prolonged Casualty Care, Rescue Extraction, and Tactical Evacuation. A resident near Bay 5 stopped writing. Reed continued. 41 operational recoveries, multiple mass casualty deployments, attached medical support to Special Operations Aviation and Maritime units. Kessler's eyes narrowed. She listed none of this on her application. I listed military medical service, Mara said. You listed flight nursing and emergency care. That was what I was authorized to list. Reed turned another page. Her records were restricted after Operation Nightbridge. Civilian credentialing received the unclassified portion. Kessler looked at Mara. You let this hospital believe you were inexperienced. I am new to this hospital. That is not the same thing. No. Mara's answer was quiet. That was the point. The emergency department listened. Some staff looked impressed. Others looked betrayed. Mara preferred neither. She had not hidden Raven because she wanted mystery. She had hidden Raven because every time someone discovered the name, Gabriel died again in their questions. Reed removed a small photograph from the folder. It showed 4 people beside a damaged rescue aircraft. Admiral Voss, younger, and bleeding through a field dressing. Mara kneeling beside him. Captain Reed standing near the open cabin. And Gabriel Shaw smiling into the camera as if death had never learned his address. Mara looked away first. Reed returned the picture to the folder. Admiral Voss requested Keene by call sign before reaching the hospital. Kessler said, he was hypotensive and confused. He recognized an operator from a mission 7 years ago. He recognized a nurse. He recognized the person who kept him alive long enough to become an admiral. The sentence settled across the department. Kessler opened his hand. Mara's badge rested against his palm. He did not return it. Not yet. The suspension remains pending administrative review. Ortiz gave him a look of disbelief. Reed closed the folder. Then review it while she works. That is not your decision. A monitor alarmed in Bay 6. Sadie Monroe's pressure had fallen again. Mara moved instinctively. Kessler stepped between her and the bay. You are not assigned to that patient. Mara looked past him. Sadie had curled onto her side, one arm pressed against her abdomen. Her pain has moved to the left lower quadrant. You cannot know that from here. She is protecting that side. Kessler glanced back. Sadie vomited again. Ortiz said, let her assess. For a moment, Kessler did nothing. Then he moved aside. Mara entered the bay. Sadie's pulse was 138. Her skin was cold now. The bruise from the restraint harness had darkened. Pain worse? Sadie nodded. Different. Where? She pointed lower. Mara checked the repeat laboratory results. Hemoglobin down. Lactate rising. Not catastrophic. Moving in the wrong direction. She looked at the resident. Call CT and tell them this is no longer routine follow-up. The resident glanced toward Kessler. Kessler hesitated, then said, Do it. The resident ran. Mara looked at Marcus Hale in the next bay. He had stopped joking with the orthopedic technician. His pulse had climbed too. The crash had left a pattern. Not identical wounds, identical delay. Bodies holding themselves together until they could not. Reed stepped beside Mara. You saw this overseas? Deceleration injuries, improvised restraints, patients walking until circulation fails. Same aircraft section? Most of them. Reed's face tightened. The helicopter rotated before impact. Rear cabin took the lateral force. Who was seated there? He opened a tablet and pulled up the passenger manifest. 9 names appeared. Voss, Monroe, Hale, Brooks. 5 others. Mara counted them twice. Voss had said 9 more. That meant 10 survivors, including him. The manifest showed only 9 people total. Before she could speak, a nurse called from the surgical phone. Dr. Ortiz, they need you upstairs. Brooks is unstable. Ortiz looked at Mara. Sadie's scan first, then call me. She left at a run. Kessler stayed near the desk, watching the department respond to Mara without waiting for him. It was the first time his authority looked less like power and more like distance. Reed lowered his voice. Voss is awake. Mara turned. Already? Briefly. ICU asked for you. Kessler said, She is suspended. Reed did not even look at him. Admiral Voss is requesting the only person who understands his operative history. Kessler's expression hardened, but he had no clean argument left. 5 minutes, he said. Mara followed Reed toward the ICU elevators. Her badge remained in Kessler's hand. She could feel its absence against her chest. The doors closed. Reed stood beside her in silence for 3 floors. Then he said, You disappeared well. I resigned. You vanished. I changed jobs. You changed states 3 times. Mara looked at the elevator numbers. That sounds like research. Voss kept looking. He should have stopped. So should Gabriel. Her eyes snapped toward him. Reed did not apologize. There is a recording from Knightbridge. Mara's throat tightened. No. He made a transmission after the first extraction. I heard the last transmission. You heard part of it. I heard enough. No. You heard yourself asking him to come with you. You heard him refuse. Then your aircraft lost the channel. The elevator opened. Mara did not move. Reed held the doors. What happened after? He transmitted again. Her voice came out lower. To whom? To command. What did he say? Reed studied her. You are not ready to hear it in a hallway. Then you should not have mentioned it. He said your name. Mara stepped out before the doors closed on them. Admiral Voss lay in the intensive care unit surrounded by machines. The surgery had drained the strength from his face. Tubes crossed beneath the blanket. A monitor traced each heartbeat in green light. His eyes opened when Mara entered. Raven. The word was barely sound. Mara moved to the bedside. You survived. Voss's mouth shifted. So did you. Apparently. Reed stayed near the door. Voss looked toward him, then back at Mara. Gabriel. Her hands went still. Do not do this tonight. He told us. You were unconscious. After. Mara shook her head. You do not remember. I remember waking in the aircraft. I remember asking where he was. Voss swallowed with difficulty. You said he was coming on the second lift. Mara stared at the blanket. He did not. No. I chose you. You followed his order. I left him. He made you leave. The monitor accelerated. Mara stepped back. Voss lifted one weak hand. Recording. Reed moved closer. It exists, he said. Mara looked between them. 7 years of guilt shifted beneath her feet. Not gone, only disturbed. An ICU nurse entered. Her emergency department needs her. She handed Mara a phone. The charge nurse spoke quickly. 2 more crash patients are deteriorating. Monroe's repeat scan is positive. Hale's lactate doubled. Dr. Kessler wants you back downstairs. Mara almost laughed. He wanted her back now, not reinstated. Useful. There was a difference. She looked at Voss. Rest. His fingers caught her wrist. 9 more. We found 8 besides you. Voss's eyes sharpened. No. Mara leaned closer. The manifest has 9 total. Wrong. His breathing became shallow. Who is missing? Voss fought for the words. Crew chief. Reed opened the passenger list again. Mara scanned the names. Pilot, co-pilot, Admiral, flight medic, rescue swimmer, security officer, 2 naval staff, Lieutenant Monroe. No crew chief. She looked at Reed. Who secured the rear cabin? His face changed. Staff Sergeant Noah Briggs. Where is he? Reed searched the tablet. No admission. No ambulance record. No transfer. Nothing. Voss tightened his grip around Mara's wrist. He walked away. Mara looked toward the ICU doors. A man had survived the same impact. He had occupied the section taking the greatest force. And somewhere outside the trauma system, he believed he was uninjured. Mara released Voss's hand and turned to Reed. Find Noah Briggs before his body proves the manifest wrong. Staff Sergeant Noah Briggs had not left the hospital. He had never entered it. Mara found him in the main waiting room, sitting beneath a television that replayed the crash without sound. A Navy helicopter lay broken across wet grass on the screen. Beside him sat a teenage girl holding 2 untouched coffees. Captain Reed reached them first. Briggs. Noah looked up. Mud dried across his boots. A small cut marked his jaw. His flight jacket rested over his knees. Captain. Why are you out here? They checked me at the scene. I walked away. The girl stood. I'm Emma, his daughter. Mara studied Noah, not the cut. The way he sat, back straight, both feet planted, elbows locked against the chair. People with simple soreness shifted. Noah was holding still because movement hurt. When did you last stand? Mara asked. Maybe 20 minutes ago. Stand now. He gave her a tired smile, then pushed against the armrests. The smile vanished. His right hand moved toward his abdomen. He made it halfway up and dropped back into the chair. Emma stepped closer. Dad? Just stiff. Mara crouched in front of him. Cold fingers. Sweat at the hairline. Pulse fast and thin. Any dizziness? When I stood. Abdominal pain. Muscles. Where? He pointed beneath his ribs. Mara pressed gently. His jaw tightened. She moved lower. The muscles beneath her hand were rigid along the right side. Your pulse is 126. I had coffee. The cup is full. Emma looked at it, then at her father. Mara stood. You need a trauma bed. Noah shook his head. They said I was fine. Did you have imaging? No. Blood work? No. Then nobody said you were fine. They said you were walking. Reed's voice softened. Your daughter needs you alive. Mara called the emergency desk. I found Briggs. Bring a stretcher to the main waiting room. Dr. Kessler took the phone. Does he have symptoms? Cold skin, tachycardia, orthostatic dizziness, and abdominal guarding after high-energy deceleration. You cannot diagnose shock from a waiting room. I can recognize it. The stretcher arrived. Noah refused it until he tried to stand again. His knees folded. Reed caught one arm. Mara caught the other. Emma dropped the coffee. Noah's eyes lost focus. Get him flat. They lowered him onto the stretcher. Emma, he whispered. I'm here. Mara kept one hand near his shoulder. She is coming with us. He nodded once. The emergency department had changed while Mara was upstairs. Sadie Monroe was being prepared for surgery. Marcus Hale lay beneath warm blankets with blood running through one IV. Daniel Brooks remained in the operating room. Admiral Voss remained in intensive care. Every crash survivor who had looked stable was now being watched for hidden injuries. Noah became the next one. Pulse 138. Blood pressure 92/54. Oxygen normal. That comforted no one. Mara cut open the lower part of his undershirt. A faint restraint bruise crossed his abdomen. Kessler entered with the ultrasound. He was not on the manifest. Crew chief, Reed said. He secured the rear cabin before impact. Kessler placed the probe. The first view looked clean. The second did too. No obvious free fluid. Mara watched Noah's face as the probe moved over the right side. His fingers curled against the sheet. "You hurt there?" "Not much. That was not the question." "Yes." Kessler wiped away the gel. "Fast negative. We get labs and CT. His pressure fell when he stood. He may be dehydrated. He was in the rear cabin. That is not a diagnosis." "No. It is a warning." Kessler looked at her. "You do not need to turn every patient into a contest. This is not about winning. Then stop treating disagreement like negligence." Emma spoke from the wall. "My dad never says when something hurts." The room quieted. He finished a rescue swim with a torn shoulder because he did not want anyone to replace him. Noah closed his eyes. "Emma, you told me that story." Kessler looked back at the monitor. "Pulse 144. Mara said, 'Call CT now.'" He hesitated, then nodded. The scan began 12 minutes later. Mara waited behind the glass with Reed and Emma. The first images appeared. Liver intact. Spleen intact. Then the bowel. A dark pocket of fluid sat between loops of intestine. The radiologist leaned closer. Mesenteric hematoma. The next image showed a thin, bright leak. Active bleeding. Emma whispered, "What does that mean?" Mara did not soften it. "He is bleeding inside." The scanner alarmed. Noah's pressure dropped to 68/36. "Get him out!" The table slid forward. His eyes were open, but he no longer responded. Mara checked his pulse. Faint. "Kessler, he needs surgery now." He was already calling. "Activate OR3. Massive transfusion. Notify general surgery." Emma stood frozen. Mara took her hand. "Your father is going to surgery. Is he going to die?" "I do not know." The truth hurt more than reassurance. "But we found the bleed. That gives him a chance." They rolled Noah toward the elevators. Halfway there, an alarm sounded from Marcus Hale's bay. His pressure had collapsed. A dark bruise spread across his left flank. "Second internal bleed," the resident shouted. The corridor split. Noah moving toward surgery. Marcus failing in the trauma bay. Kessler turned to the charge nurse. "Call Ortiz. She is operating on Brooks. Call Patel. With Monroe. Blood bank?" The answer came over the phone. 6 units O negative available. 4 already released. Kessler went still. "How many cross-matched for Briggs?" 2 pending. "And Hale?" "No match completed." Reed stepped forward. "Activate the base donor protocol." Kessler looked at him. "This is not a field hospital. It is a military medical center with a pre-screened emergency donor registry." The charge nurse nodded. "Walking blood bank." Kessler frowned. "It has never been activated here." Mara looked toward Noah's elevator, then toward Marcus. "Tonight is a good time to learn. Uncross-matched whole blood carries risk. So does letting 2 men bleed out." Kessler looked toward the administrator approaching from the hall. "Risk management must authorize it." Mara said, "Call them while Reed calls the donors." "You do not make that decision." Dr. Ortiz's voice came through the wall phone. "Adrian," the charge nurse had placed her on speaker. "Activate the protocol," Ortiz said. "You are in surgery. I am the vascular attending on call. 2 unstable military patients. Insufficient blood. Activate it." A pause. Then Kessler faced Reed. "How fast?" 15 minutes if security opens the east gate. "Do it." Reed was already moving. The hospital shifted. Military police cleared a corridor. The blood bank opened emergency kits. Calls went across the base. Names, blood types, locations. Mara returned to Marcus. His eyes opened. "Brooks? In surgery. Monroe? Going next." He tried to smile. "Busy night. Stay for the morning." His pressure continued falling. The phone rang again. The blood bank supervisor sounded strained. "The donor team will take at least 15 minutes. How many units remain?" Kessler asked. 2. The trauma bay seemed to hear the answer. Noah Briggs was already entering surgery with active internal bleeding. Marcus Hale was losing pressure in front of them. 2 units. 2 men. Enough blood to give one of them a chance. 2 units. 2 men. Enough blood to give one of them a chance. Doctor. Kessler stood between the trauma bay and the surgical elevators, staring at the blood bank report as if another answer might appear. It did not. Noah Briggs was already being opened in OR3. Marcus Hale's pressure had fallen to 58/34. The first donor would not arrive for at least 15 minutes. Kessler looked at Mara. Who gets the blood? Every person nearby heard him. The resident, the charge nurse, Captain Reed, Marcus himself. Mara looked at the 2 units hanging inside the transport cooler, then at Marcus, then toward the elevator carrying Noah. You do not choose one. Kessler's voice sharpened. We have 2 units. Split them. 1 each may not be enough. It may keep both alive until the donors arrive. That is not a guarantee. Neither is giving both to 1 patient. The monitor alarmed. Marcus's eyes remained open. He had heard everything. Give it to Briggs, he whispered. Mara leaned close. No. He has a kid. So do you. Marcus gave a weak smile. No, I don't. You still count. His eyes closed. Mara turned to the charge nurse. 1 unit to Marcus now. Send 1 to Briggs. Activate cell salvage in both operating rooms. Warm every fluid. Draw repeat coagulation panels. The nurse looked toward Kessler. For the first time that night, he did not argue. Do it, he said. The cooler opened. 1 unit moved upstairs. The other began flowing into Marcus. Reed returned with a radio in his hand. East gate is open. First 6 donors are inbound. Screening? Kessler asked. Pre-registered, type confirmed, infectious testing current. Blood bank is repeating rapid checks. How many more? 23 answered. The charge nurse stared at him. In under 2 minutes, they heard who was bleeding. Mara looked toward the windows. Beyond the rain, headlights turned into the hospital drive. 1 vehicle, then another, then 5 more. Sailors, aircrew, and base personnel entered through the east corridor in uniforms, training clothes, and rain jackets. Some had come directly from night duty. 1 still wore engine grease on his hands. None asked who would receive their blood. Only where to stand. The blood bank supervisor met them with labels and consent forms. Type O to the first line. A and B wait behind. Identification out. Sleeves up. The hallway became an emergency donor center. Not chaotic. Purposeful. Mara moved between the trauma bay and the blood bank, translating urgency into tasks. Keep donors seated after collection. Do not rush the repeat typing. Send the first whole blood unit to OR3. Second to Trauma 2. Calcium after 4 units. Kessler followed beside her. You have run this before. Yes. Where? She did not answer. He stopped walking. Mara. She turned. Do you need the location, or do you need the protocol? His jaw tightened, then released. The protocol. She gave it to him. Low titer O whole blood first. Warmed. Track every unit by destination. Do not let 2 teams assume the other is replacing calcium. Recheck temperature and fibrinogen early. Kessler repeated the instructions to the blood bank. Not as his own. Not this time. Follow Keen's sequence. The words surprised the staff. They surprised Mara more. The first emergency donor unit reached Marcus 9 minutes later. His pressure climbed to 64, then 68. Not safe. Better. Upstairs, the operating room called. Noah's mesentery had torn across a long section. Surgeons had controlled the largest vessel, but diffuse bleeding continued. The whole blood reached them in time. Daniel Brooks remained unstable in another operating room. Sadie Monroe had entered surgery. 4 patients. 4 separate teams. 1 crash still unfolding. Mara stood at the central board and rebuilt the night from fragments. Seat positions. Restraint marks. Initial scans. Pulse changes. Pain patterns. Time to deterioration. Kessler watched her draw lines between names. You think there is another one? I think Voss did. The manifest is corrected. Briggs was the missing passenger. Mara looked at the list. 10 people now. Voss plus 9. The count was finally right, but something still felt wrong. The helicopter had carried a pilot and co-pilot. Both names were listed. Co-pilot Evan Cole had been admitted with a fractured forearm. The pilot, Commander Thomas Vale, had been evaluated at the scene and transferred to a smaller observation unit on the 5th floor. His chart showed normal initial imaging, normal blood pressure, mild back pain, no repeat labs ordered. Mara circled his name. Kessler leaned closer. He is admitted. Not to trauma. He was stable. So was everyone else. The sound came before the memory. Rotors. A helicopter lifted from the base beyond the hospital, carrying a surgical team toward another facility. The vibration passed through the windows. Mara's breath stopped. The central board disappeared. Night replaced it. Black ocean. Red cabin light. Gabriel's hand around her wrist. Take Voss. I am not leaving you. That is an order, Raven. Gunfire struck the aircraft's skin. Someone screamed for pressure. Gabriel pushed the Admiral toward her. Bring them home. Mara's fingers went numb. The pen fell from her hand. Kessler caught her elbow before she struck the desk. Mara? She pulled away. I'm fine. You are not. The rotor noise deepened. For 1 second, the hospital ceiling seemed too low. The lights too red. Blood warmed her gloves that were not there. Gabriel was still on the ridge, still waiting for the second aircraft, still calling through static she could no longer answer. Mara stepped into an empty supply room and shut the door. She pressed both hands against the counter. 4 counts in. Hold. 4 counts out. Again. It did not work. A knock came. Kessler stood outside. Marcus is responding. Mara kept her back to him. Good. Briggs has surgical control. Good. The donor line is functioning. Then you do not need me. Silence. Kessler opened the door halfway. I spent this entire night telling you that. Mara looked at him. He did not enter. I was wrong. The admission should have mattered. It did not reach the place inside her that was still on the ridge. I cannot hear the rotors without going back. Kessler's expression changed. Not pity. Understanding. Then do not listen to the rotors. They are not outside. A phone rang at the central desk. The ICU nurse answered, then appeared at the supply room door. Admiral Voss is asking for Mara. I cannot go up. He anticipated that. The nurse held out a hospital tablet. Voss's face appeared on the screen. Pale. Exhausted. Alive. A breathing tube was gone, but oxygen rested beneath his nose. His voice came through thin and rough. Raven. Mara almost closed the screen. Do not call me that. Why? You know why. No. You were there. I was unconscious for most of it. Gabriel was not. Voss's eyes held hers. He made the choice. I left him. You evacuated 4 wounded men. I left him. He ordered you to. I could have gone back. The aircraft was hit before it cleared the ridge. Mara's throat tightened. There was a second lift. Yes. It arrived too late. Yes. The word cut cleanly. Voss did not soften it. He knew it might. Mara looked away. He transmitted after you left. Voss continued. Reed told me. He said you would blame yourself. Her eyes returned to the screen. What exactly did he say? Voss took a careful breath. He said, Tell Raven I stayed because someone had to hold the line. She did not leave me. She brought them home. The room became very still. Mara's hands started to shake. 7 years of memory shifted. Gabriel had not been waiting for her. He had been protecting the aircraft carrying Voss and 3 wounded men. Protecting her. Voss leaned closer to the camera. Raven was never the name of a ghost. Mara closed her eyes. It was the name we used when help was coming. The sentence broke something open. Not enough to heal it. Enough to breathe. Behind her, the emergency department continued. Phones. Footsteps. Monitors. People alive because the night had not been allowed to decide for them. Mara picked up the pen she had dropped. I need Commander Vale's repeat labs. Kessler was still in the doorway. I will order them. No. He waited. Mara looked at him. We order them. For the first time, he nodded without correction. They returned to the central board. Commander Thomas Vale's 5th floor nurse answered the call. He is sleeping. Wake him, Mara said. He received pain medication 20 minutes ago. What medication? Hydromorphone, low dose. Current pulse? A pause. 118. Pressure? Let me check. Silence. Then the nurse's voice changed. 98/60. Mara looked at Kessler. Bring him to trauma now. The nurse hesitated. He is already scheduled for morning discharge. Kessler took the phone. This is Dr. Adrian Kessler. Cancel discharge. Repeat hemoglobin and lactate. Transfer him with monitoring. Mara watched him. He covered the receiver. What? You listened. His answer was quiet. I am learning. The first lab result returned 6 minutes later. Commander Vale's hemoglobin had fallen 3 points. Lactate had doubled. Kessler called the elevator team. Priority transport. No delays. On the 5th floor, Vale insisted on walking to the stretcher. He made it 3 steps before dizziness forced him to sit. The transport team placed him on the bed and entered the service elevator. Mara watched the floor numbers descend on the tracking screen. 5. 4. Then the number stopped. Between floors. The phone at the desk rang. The elevator technician's voice came through first. Service lift stalled. Then shouting behind him. A nurse screamed for a code team. The line filled with the continuous tone of a heart monitor. Mara grabbed the phone. What happened? The answer came breathless. Commander Vale has no pulse. Kessler was already running. Mara followed him toward the stairwell as the overhead announcement echoed through the hospital. Code Blue, Service Elevator 2. Code Blue, Service Elevator 2. The last crash survivor had arrested inside a locked box between floors. Code Blue, Service Elevator 2. Mara reached the stairwell before the announcement repeated. Kessler followed 1 step behind her. Elevator access? 3rd floor maintenance panel, he said. They ran down. The hospital blurred into doors, rails, and white light. Mara heard the code team moving on the other side of the walls. A locked elevator between floors. A patient without a pulse. A nurse trapped inside with no room to work. By the time Mara reached the 3rd floor, security had opened the outer service door. The elevator car sat 6 feet below them. Too low for a normal exit. Too high to reach from the floor beneath. A maintenance technician knelt beside the opening. We can lower it manually. How long? Kessler asked. 3 minutes. The nurse inside shouted through the gap. He is still pulseless. We started compressions. 3 minutes was too long. Mara dropped to her knees and looked into the car. Commander Thomas Vale lay flat on the elevator floor. His uniform shirt had been cut open. One nurse performed chest compressions, while another squeezed oxygen through a mask. The cramped space forced them to work from bad angles. Any rhythm? Mara called. Asystole, then Pia. Access? 1 IV. Blood? None. Kessler looked down. Continue CPR. Give epinephrine. The nurse pushed the medication. Mara studied Vale's abdomen. Even from above, she could see the swelling. His left side rose higher than the right. Not from breathing, from blood. She looked at the small ultrasound machine trapped beside the stretcher. Can you scan his abdomen? There is no space. Turn the probe sideways, right upper quadrant first. The nurse reached across Vale while compressions continued. The image appeared on the screen. Dark fluid surrounded the liver. Kessler saw it. Massive hemoperitoneum. Mara said, he arrested from blood loss. Kessler shouted toward the hallway. Bring uncross-matched blood to this floor. Activate or 1. The blood bank technician arrived with 2 units from the new donor supply. The elevator had still not moved. Mara looked at the maintenance opening. Can someone fit through? The technician shook his head. Not safely. Reed appeared behind them. He took 1 look at the gap. I can. No, Mara said. I have rope training. So do I. Before anyone could stop her, Mara secured a rescue belt around her waist. The maintenance technician clipped the line to a fixed anchor. Kessler grabbed her arm. You are not dropping into an elevator shaft. There is a bleeding patient below us. There is a code team with him. They cannot transfuse fast enough from that position. You could fall. Mara looked at him. Then hold the line. The words stopped him. Not because they were dramatic. Because he finally understood what kind of person stood in front of him. Reed took the secondary line. Mara lowered herself through the opening. Her shoes struck the roof of the elevator car. The technician pointed toward the emergency hatch. She opened it and dropped inside. The air smelled of sweat, metal, and blood. Vale's skin had turned gray. His pulse remained absent. Mara took the first blood unit. Pressure bag. The nurse handed it over. Continue compressions. Do not pause unless we have a rhythm. Kessler's voice came from above. Can you reach the monitor? Yes. Ultrasound the heart. Mara placed the probe beneath Vale's ribs. The image trembled with each compression. Stop for 5 seconds. The room froze. The heart moved weakly. Not enough to create a pulse. Cardiac activity present. Resume. Kessler answered immediately. Blood, calcium, second epinephrine. The first unit entered under pressure. Mara attached the second. Vale's abdomen continued to expand. He was not bleeding slowly. The transfusion was replacing only part of what he lost. The elevator began to lower. Metal groaned around them. 1 foot, 2. Then it stopped again. The technician shouted, "Brake is stuck." Kessler swore under his breath. Mara looked at the floor indicator. They were level with the second-floor emergency access door. "Open the lower gate." Security forced the outer doors apart. The car remained slightly above the floor. Enough. Mara and the nurses lifted Vale onto the stretcher. The code team pulled from outside. The wheels struck the threshold hard. Then the stretcher was free. They ran toward the operating room. Compressions continued through every turn. The second blood unit emptied. A faint pulse appeared beneath Mara's fingers. "Stop compressions." The monitor showed a narrow rhythm. 48. Then 52. "I have a carotid pulse." No one celebrated. They moved faster. At the OR entrance, Dr. Ortiz appeared in a blood-stained gown. "Noah is stable enough for my fellow to close." "What happened?" "Delayed intra-abdominal hemorrhage," Kessler said. "Cardiac arrest in the elevator. Return of circulation after blood." Ortiz looked at the ultrasound image. "Source?" "Unknown. The scan is not clear," Kessler said. Mara pulled the passenger diagram from her pocket. Pilot's seat took the first lateral impact. His harness anchored higher than the rear cabin. The force crossed from left shoulder to right hip. Ortiz followed the line with her finger. "Possible mesenteric root, or retroperitoneal vessel," Kessler said. Mara shook her head. His back pain came first, then falling hemoglobin, now rapid abdominal expansion. Kessler looked at her. "What is your map?" She pointed below Vale's ribs. "Central mesenteric tear with delayed rupture. Open high enough to gain control before the bowel," the anesthesiologist called out. "Pressure 62 systolic and falling." Ortiz looked toward OR3. "I cannot leave Briggs." Kessler was the only attending surgeon available. For 1 second, the old hesitation returned. Not fear of the operation, fear of being wrong. He looked at the imaging, then at Mara, the woman he had suspended. The woman whose warnings had been right every time the hospital chose not to listen. "Prepare OR1, he said. The team moved. Kessler looked directly at Mara. "We follow her map." The doors opened. Vale disappeared inside. Mara stayed outside this time. She was not a surgeon. She had never claimed to be. Her work was recognizing the road before someone else walked into danger. Reed stood beside her. "You trusted him." "No. You sent him in." "I trusted that he finally understood the cost of certainty." The surgery lasted 93 minutes. Noah Briggs stabilized first. Daniel Brooks followed. Sadie Monroe required removal of a damaged bowel segment, but survived. Marcus Hale responded to whole blood and underwent embolization instead of open surgery. At 3:47 in the morning, Kessler stepped out of OR1. Blood marked his shoes. His shoulders had dropped beneath the weight of the night. Mara stood when she saw him. "Well?" "Mesenteric root tear." She closed her eyes. Kessler continued. "He lost almost half his circulating volume. We controlled it. He has a long recovery ahead. But he is alive." "Yes." The word carried no victory, only relief. Ortiz joined them from the next corridor. "Briggs is stable. Brooks too." Reed looked toward the central board. All 10? Mara counted the names. Voss, Monroe, Hale, Brooks, Briggs, Vale. 4 others under observation. All alive. All 10, she said. Morning reached the hospital before anyone noticed. Gray light entered through the emergency windows. The donor line had shortened. Empty blood bags filled marked containers. Nurses sat against walls for 1 minute at a time before standing again. The night had changed the building. Not because an Admiral had arrived, because the hospital had nearly lost people it believed were stable. At 8 o'clock, administration called an emergency review. Mara entered the conference room wearing the same navy scrubs. Her badge was still missing. Kessler sat at the far end of the table. Ortiz sat beside him. Reed placed the sealed folder in front of Mara, but did not open it. The hospital director began. We are reviewing multiple deviations from protocol. Mara almost smiled. Hospitals liked that phrase. It made mistakes sound mechanical. Kessler spoke before the director could continue. The first deviation was mine. The room turned toward him. He placed Mara's badge on the table. I dismissed repeated clinical concerns, because they came from a nurse I believed was inexperienced. The director shifted. Dr. Kessler, this review concerns several parties. It concerns me. His voice remained steady. I relied too heavily on initial imaging. I treated disagreement as insubordination. I nearly proceeded with a fatal surgical approach on Admiral Voss. I supported discharge for patients with evolving injuries. And I suspended the person identifying the pattern. No one interrupted. Kessler looked at Mara. I confused authority with certainty. Mara did not rescue him from the silence. He needed to stand inside it. Ortiz added, serial examinations should have been mandatory after the crash mechanism was known. The charge nurse spoke next. Nursing concerns were documented, but escalation depended on physician approval. Reed said, that system failed repeatedly. The hospital director looked toward Mara. What changes do you recommend? Not what happened. Not who she had been. What changes? That mattered more. Mandatory observation for high-energy deceleration injuries, she said. Repeat labs. Serial abdominal examinations. Clear escalation authority for nurses when a patient's condition changes. And no punishment for activating review in good faith. The director wrote each one down. Mara continued. Patients do not become safe because the first scan looks normal. Kessler nodded. I support every recommendation. The review ended without applause. That made it feel more real. Afterward, Reed stopped Mara in the empty hallway. He held a small recorder. Nightbridge transmission. Mara stared at it. You said I was not ready. You were not. And now? Now you brought 9 people home without becoming the ghost you thought you were. He pressed play. Static filled the hallway. Gunfire. Rotor noise. Then Gabriel Shaw's voice, weak, breathing hard. Command. First bird is clear. Raven has Voss and 3 wounded aboard. A pause. More static. She will try to come back. Mara's throat closed. Gabriel continued. Do not let her. His voice broke once, then steadied. I stayed because someone had to hold the line. She did not leave me. A distant explosion swallowed several words. Then the final sentence came through. She brought them home. The recording ended. Mara stood without moving. 7 years of guilt did not disappear. Grief did not work that way. But for the first time, the memory belonged to Gabriel too. Not only to her punishment of herself. Reed placed the recorder in her hand. You should keep it. Mara closed her fingers around it. From the ICU doorway, Voss watched her. He had been moved to a chair for only a few minutes. Oxygen rested beneath his nose. Every movement cost him. Mara walked toward him. You should be in bed. You sound like a nurse. I am one. His eyes moved to the badge in her other hand. Again? Apparently. Voss studied her face. Then he asked the question she had been avoiding since the moment he called her Raven. When this hospital knows who you are, will you disappear again? When this hospital knows who you are, will you disappear again? Mara looked at Admiral Voss. He sat in the ICU doorway beneath a blanket, pale from surgery. oxygen resting beneath his nose. The man who once commanded ships now needed both hands to hold a cup of water. Still, his eyes had not changed. They waited for an honest answer. "I do not know," Mara said. Voss nodded slowly. "Better than a lie. You recognize those easily tonight. I had practice." Mara looked down at the two objects in her hands. Her hospital badge, Gabriel's final transmission. One represented the life she had chosen. The other represented the life she thought she had abandoned. For 7 years she had treated them as enemies. Voss watched her. "Reed will offer you a uniform." "I know. Will you take it?" "No." The answer came faster than she expected. Voss leaned back in the chair. "Why?" "Because Raven belonged to a team that no longer exists." "Teams change. People die." "Yes." Mara looked through the ICU glass. Daniel Brooks remained sedated after surgery. Noah Briggs's daughter slept in a chair beside his bed. Sadie Monroe had survived a bowel resection. Marcus Hale was stable after embolization. Commander Thomas Vale remained on a ventilator, but his heart beat without compressions. 9 people besides Voss, all still alive. Mara clipped the hospital badge back onto her scrubs. "I am not going back to extraction missions." Voss's mouth shifted. "That was not my question." Mara met his eyes. "No, I am not disappearing." For the first time that night, the Admiral smiled. It was small, painful, enough. 3 weeks later, Atlantic Naval Medical Center no longer looked like the building Mara had entered as a probationary nurse. The walls were the same. The floors still smelled of disinfectant. The coffee was still terrible, but the trauma board had changed. A new protocol hung beside it. High-energy deceleration injury response, mandatory observation, repeat blood work, serial examinations, immediate review for changing pain, pulse, or pressure. No discharge based on a single negative scan when the mechanism remained dangerous. Below that was a second notice. Any nurse could request an independent trauma review without approval from the original attending physician. No punishment. No retaliation. No delay. Mara read the notice every morning, not because she liked seeing her recommendations printed, because hospitals forgot easily. Paper made forgetting harder. Dr. Kessler found her near the board before the start of shift. He carried no tablet. No audience followed him. "I owe you an apology," he said. "You already spoke at the review. I spoke about my decisions." Mara waited. He took a breath. "I treated your quietness as weakness. Then I treated your experience as a threat. That is more accurate. I also suspended you after you saved 2 patients. 3 by that point." Kessler nodded. 3. Mara did not make it easier for him. Apologies mattered more when they were allowed to remain uncomfortable. He continued, "I cannot undo that. No, but I can make sure I do not repeat it. That part matters." Kessler looked toward the trauma bays. "I asked administration to remove the disciplinary note from your record. They already did. I also recommended you for permanent appointment." Mara raised an eyebrow. "You are still probationary," he said. "I was wondering when someone would remember." A trace of embarrassment crossed his face. "You are no longer under review." "Good." He started to leave, then stopped. "Mara." "Yes?" "When the next patient does not match the chart, I want you to say so." She looked at him. "I was going to." This time, he almost smiled. Noah Briggs returned first. He entered the emergency department in a wheelchair because standing still made him dizzy, though he insisted he could walk. Emma pushed him. She wore a sweatshirt from her father's squadron and carried 2 coffees. Both cups were full. Mara noticed. Emma did too. "No caffeine until the surgeon clears him," she said. Noah rolled his eyes. "She has become impossible. She was trained by the right people," Mara replied. Emma hugged her before asking permission. Mara froze for 1 second, then returned it. Noah held out a small metal object. It was a bent restraint buckle from the helicopter. Investigators said this tore loose during impact. Mara turned it over in her palm. "You kept it?" "I needed proof that I was not imagining how hard we hit." You almost died because you believed walking meant safe. I know. He looked toward Emma. I know now. His voice dropped. You told her the truth. Mara nodded. You gave me a chance to. Noah looked at the badge on her chest. Voss was right about you. He usually thinks so. He said Raven always comes when people are lost. Mara handed the buckle back. Then people should stop getting lost. Daniel Brooks returned 2 days later with a cane and a scar across his abdomen. Sadie Monroe arrived the following week. Marcus Hale sent a photograph from rehabilitation, holding a sign that read, Still counts. Commander Vale took longer. He woke after 9 days. His first question was whether the helicopter had landed. His second was whether his crew had survived. When the nurse told him all 10 were alive, he closed his eyes and cried without sound. Mara stood outside the room. She did not enter. That moment belonged to him. 6 weeks after the crash, the hospital opened the Joint Trauma Recognition Program. The name was too long. Most hospital names were. Its purpose was simple. Military medics, emergency nurses, and civilian trauma teams would train together. They would study field injuries that did not behave like textbook cases. They would learn how to recognize delayed bleeding, unusual anatomy, blast effects, and the small changes that appeared before monitors became dramatic. Captain Reed offered Mara the leadership position, not military command, not a return to classified missions. A bridge. She accepted. The announcement took place in a conference room instead of an auditorium. No music. No reporters. No row of officers waiting to salute. Mara preferred it that way. Reed placed a black box on the table. Inside rested her old Raven patch. The fabric had faded. One edge had been repaired with black thread. Gabriel had sewn that edge during a flight across the Mediterranean after Mara tore it climbing through a wreck. Reed pushed the box toward her. This belongs to you. Mara touched the patch. For years she had imagined destroying it, then hiding it, then giving it to someone who could carry the name without grief. Now she understood the name was not the wound. The silence around it had been. She lifted the patch from the box. Reed looked toward her hospital uniform. You do not have to wear it. I know. She placed it inside her medical bag, beside a stethoscope, beside trauma shears, beside the hospital identification card bearing the simplest title she had ever held. Mara Keene, RN. Admiral Voss entered the room with a walker. The therapist had argued for a wheelchair. He had ignored them. His steps were slow, but each one was his. Everyone stood. Voss waved them down. I have had enough people standing because I entered a room. He stopped beside Mara. Rookie nurse, he said. Several people laughed. Mara looked at him. That never fit you, Voss continued. I was new to the hospital, not to telling admirals what to do. Especially not that. He glanced toward the medical bag. Where is the patch? Inside. You are not wearing it? My badge already says what I do. Voss studied the plain identification card. Just nurse. Mara's expression hardened. Not just. Voss nodded. Fair correction. 3 months after the crash, all 10 survivors returned to the hospital. Not for a ceremony. For the first training session. Daniel demonstrated how mild pain had hidden major bleeding. Sadie showed the restraint bruise that had almost been dismissed. Noah stood beside Emma, while she explained why family members should be heard when they said a patient was minimizing pain. Commander Vale walked into the room without assistance. Marcus Hale raised 2 fingers toward Mara. Recognition between survivors. No applause, no medals. Just living people telling the truth about how close they had come to being missed. Dr. Kessler stood at the back of the room taking notes. When Mara spoke, he did not interrupt. Neither did anyone else. That afternoon, the emergency department received a civilian bus driver injured in a highway collision. His first scan looked normal. His pressure did not. A resident began to say it might be anxiety, then stopped. He looked toward Mara. Something does not fit. She checked the patient's pulse. Cold skin. Worsening abdominal pain. A restraint mark beneath his shirt. The pattern was different. The warning was the same. Repeat the labs, Mara said. Keep him here. The team moved without debate. No one asked who gave her permission. No one asked what she had been before. The patient mattered more than the answer. As the trauma doors closed, Mara's medical bag rested beneath the desk. Inside it, the old Raven patch lay beside her ordinary nursing tools. Not hidden, not displayed, carried. Her badge still said nurse. But when the wounded needed a way home, they knew to call Raven.